To date, we've had no confirmed cases of measles in Gibraltar, but we remain vigilant for the possibility of cases. And that's why we've issued a press release encouraging anyone of any age, if you've not had measles or you've not had a measles-containing vaccine, please contact the primary care centre and we can arrange for you to have a vaccine.
Do we have any sense of how many people in Gibraltar are vaccinated against measles?
It's quite difficult to calculate because we don't have an accurate denominator population for the hospital. By that I mean not just people who are resident in Gibraltar, but people who are registered and entitled to Gibraltar healthcare.
But of the people registered with the GHA, do you have a figure of how many do have the MMR or a similar vaccine?
So we've done some analysis. I chair the immunisation committee and we did some analysis last year trying to understand what our percentage of MMR uptake was. We came up with a range of where it could be because some people, their cards have expired, for example, but if they're a child and it's part of their routine vaccine schedule, we will still vaccinate that child. So our range in vaccination is probably somewhere between the top 60% up to over 100%, which you can't have a percentage uptake of over 100%. But what that reflects is we do actually vaccinate some children who are resident here and their cards may have expired. Talking to our health visitors, we actually have very few people who fully decline the MMR vaccine. What we see is sometimes parents may wish to delay it slightly. So a reminder for children, they receive 2 MMR vaccines, one at about 1 year of age and one as a preschool booster. And it's very important that children have that before they go into school to give them that added protection.
If somebody thinks they might have had measles when they were young or thinks they might have had the vaccine, is there a way to test for that?
You can do antibody testing, but we're not offering that from the GHA because we don't have the resources to be able to test antibodies of large sections of the population. This is why the advice we're giving is you won't come to any harm, even if you've had measles as a child, you won't come to any harm having an additional MMR vaccine.
Okay, and what would your advice be to anyone who suspects they could have measles?
Call 111 for advice where you'll be clinically assessed. We will arrange for you to be seen by a GP and we can now do rapid in-country testing. In the past, we used to have to take the saliva samples, put them on an aeroplane, send it to the UK, and it used to take about a week to come back. We can now know within hours whether you've got measles or not, and to confirm of all the suspected cases that we've had over the last couple of years, we've had no confirmed cases of measles here yet.
Okay, and what's the protocol if someone then does test positive for measles?
We would ask them to stay at home and then we would undertake contact tracing to try and identify if there have been any close contacts who are not immune and vulnerable. And by that I particularly mean pregnant women. They're the group that we're quite concerned about. If they're not immune and not vaccinated and a close contact of a confirmed case of measles, we would assess them and then we would potentially offer them immunoglobulin. So this is an injection that gives them passive antibodies and would protect them against measles.
Have you noticed any interest in taking up the vaccine since, these stories started coming out about cases in neighbouring countries?
We've had a few inquiries, yes, and that's why I'd say to anybody, please do contact the PCC, the Primary Care Centre, if you want to arrange an MMR vaccine.
And finally, how will you be monitoring cases in those countries going forward?
I receive surveillance information both directly from the UK and also through the World Health Organization. Each week I receive alert notifications from the World Health Organization describing what outbreaks are happening globally and what to be aware of. We're monitoring those closely.